is about coronavirus disease outbreak update. And we've got a good map here in the middle of the page. And it shows how many people are infected and contracted the disease. And it also shows the different provinces and how many people in different provinces have got this disease. We've got a graph, a line graph here, and it shows how fast it is spreading around Canada. So if we just play it, you will see how fast it's moving, for example, in Ontario. Look, this is Ontario. It is starting from the first day, and it shows the whole country. So you see, it is spreading quite fast, as you can see.
Yeah, it's the real outbreak.
Yeah, that's a real outbreak. So in Quebec, it is 10,000 people affected by the virus. But in Ontario, fortunately, we have much less, about half. It is 5,000. And the whole Canada has got 19,000 cases now. So those dark blue signs, colors, have got 2,000 and higher, people who are affected by the virus. And those light colors have got fewer people, okay? So that's quite serious. The spread is quite fast and it's getting toll on the others. So we've got some news. I'm going to read the news about the global warnings and also the what Canada is doing right now. So can you see the reading?
Yes.
Yes.
Okay. So on March 11th, 2020, the World Health Organization, WHO, assessed COVID-19 as a pandemic. This assessment by the WHO is not unexpected. Describing the situation as a pandemic does not change the WHO's assessment of the threat posed by the COVID-19, and it does not change what the WHO is doing. It also does not change what countries around the world should do. For that reason, it does not change the approach we are taking in Canada. Canada's public health system is prepared. Since the outset, you know the meaning of outset?
No.
Outset means from the beginning.
No. Beginning this outbreak.
That's right, from the beginning. Since the outset, the Public Health Agency of Canada, along with the public health authorities at all levels of government across the country, has been working together to ensure that our preparedness and response measures are appropriate and adaptable based on the latest science and the evolving situation. Aside from Canada, other countries and regions are reporting cases listed below, and an official global travel discovery is in effect. Avoid non-essential travel outside Canada until further notice. So these are the things that you all the time hear on the radio or on the television. And we've got some good information about risk to Canadians, and check if you have been exposed, okay? So let's read these two as well, and then we move on to other news. COVID-19 is a serious health threat, and the situation is evolving daily. You know the meaning of evolving?
No.
Yes.
Assessing?
Engaged.
Just a moment, I have to answer the phone. This is Tatiana. Hello, Tatiana. How are you? Where are you? Okay, we are at the meeting right now. Did you use the uh, uh, new ID and the password? Did you click on the blue link I gave you on the WhatsApp? You have to click on the new link I sent you. Yeah, yeah, the new link, not the previous link. Click on the new link and enter the ID and the new password. You will be in the meeting. Yeah, you can do it on your computer as well. You just copy and paste those links in your email or just put it in your laptop so that you can do it. Okay, okay. Call me if you have any problems, okay? Have a good day. Bye. Sorry for interruption.
No,
So,
no problem.
yeah, it was Tatiana. She's got a problem with the... So, let's continue. What's the meaning of evolving then?
Assessing?
Engaged?
No, assessing, it doesn't mean that's
It's getting bad every day by day.
no,
Problem?
no.
Engaged?
Engaged?
Yeah.
No.
Changing every day.
Generate?
Changing every day.
Changing? Yeah.
Yeah.
Evolving means changing, usually for better or for bigger. Evolve means develop, means developing actually. So the situation is evolving. It means it's becoming bigger and bigger, more and more serious. And we have evolution. You know evolution? Darwin's theory of evolution.
Evolution, yeah.
Evolution.
Being better?
Yeah, when things are getting more developed, that's evolution. Throughout the history, Darwin believed that we are just descending from apes. So apes evolved into human beings. So the primary human beings probably were just apes. I don't know how we can assess this theory or whether it is correct or not, but this is Darwin's theory. Do you agree with that?
Darwin theories?
Darwin theories of
correct.
evolution. We are
Yes.
descending from, you know, apes.
Yeah, I know.
You know, apes, monkeys, chimpanzees.
Yeah.
So,
Yes.
yeah, you agree with that?
Yes.
So you mean that Adam and Eve were just two apes?
I don't believe in Adam and Eve, but I believe in evolution.
Oh, you don't believe in Adam and Eve?
No, no.
Okay, okay. So that's an idea. So what do you think were those first human beings?
I don't know, but I believe in that Darwin theory. Yeah.
Darwin's theory. Okay, yeah. I think we have Tatiana here finally. Okay, so the risk will vary. You know, vary.
Yeah, change.
It's different.
Yeah, it's different or changes between and within communities. And but given the increasing number of cases in Canada, the risk to Canadians is considered high. This does not mean that all Canadians will get the disease. It means that there's already a significant impact on our healthcare system. If we do not flatten the epic curve now, you know, flatten the epic curve?
No.
Yeah,
decrease the curve.
reduce the number of the patients.
Mm-hmm. So if you look at this curve here, this is the curve, you see? This is the curve. And it shows that it is increasing quite fast, and it can reach a peak very soon. So if it reaches a peak, it means that we will face a disaster in Canada, and the healthcare system may not be able to provide enough facilities for everybody who is affected. So that's why they believe that if you stay at home, we can flatten, flatten, make it flat, make it straight, so that fewer people are referring to healthcare system from time to time, and we won't have such a burden on the healthcare system. That's what it means by flattening the epidemic curve. Okay?
Yeah.
Clear, everybody?
Yes.
Okay. So the increase of COVID-19 cases could impact healthcare resources available to Canadians. So it can impact means
Affect.
affect, influence, yes. Check if you have been exposed. Have you been exposed on a recent flight, cruise, train, or at a public gathering? Check the listed exposure locations to see if you may have been exposed to COVID-19. So these are the most dangerous places you can be in, and you might be quite in peril if you are just traveling unnecessarily. Vulnerable populations. There is an increased risk of more severe outcomes for Canadians aged 65 and over, with compromised immune systems and with underlying medical conditions. Do you have any idea about compromised immune systems?
Yeah, those people who have cancer, people who receive chemo or radiotherapy or some medicine that suppress the immune system. These are the people who have compromised immune system.
That's right. It means they have got weakened or weaker immune systems, like old people, like some people who are sick because of cancer or because of HIV or any other kind of disease. These are called compromised immune systems. Okay? Any questions so far?
No.
So I think the rest is good information, and I'm going to send the link on the chat we have got here, so that you can have a look at it later. Oh, not this one. So in the chat room, I'm going to send the link to you. Did you see the link?
No.
No? Oh, here.
Yeah.
Okay.
Yeah.
Yes.
You can have a look at it later and read the whole information. It's a good information from government of Canada, and it gives more information about COVID-19. And you have got here, you see, this is COVID-19 virtual assistant. You can use this link if you have any questions from government of Canada or healthcare system. And if you have any concerns, if you need a test. So these are the things you can do. These are the information for contacting government directly if you are in danger or if you feel that you are contracting that kind of disease. And you can email them, or you can just telephone them and ask for help. Okay? So these are, I think, good information for you